Okay, we're going to do the sensory systems in this chapter, but the sensory systems we're going to do is just the eyes and the ears. There are others that we're not going to cover and aren't covered in your textbook. As usual, I'm going to cover the functions and anatomy of the eye, but then I'm going to talk about the word parts specific to the eye, and then go to the ear and talk about the function and anatomy of the ear, and then talk about the word parts specific to the ear. So the major function of the eye is to convert light into electrical pulses that the brain can understand. So in other words, the eye will focus an image of the world around us onto the retina, and the rods and cones in the retina are responsible for doing that conversion to electrical impulses. When we look at the structure of the eye, the outermost layer, what we would refer to as the whites of the eye, is known as the sclera. And the sclera includes a clear portion that is not white called the cornea. The cornea is the outer protecting layer of the eye. The sclera as a whole includes the cornea. It's tough, it's thick, it's fibrous, it helps maintain the shape of the eye, but it also allows light to enter the eye. So if we follow the path of light, it would enter through the cornea, go through the pupil, which is this hole in the iris, and then strike the lens. And the lens's job is to focus the light onto a specific spot of the retina called the fovea centralis, so that whatever you're looking directly at comes to focus at the fovea centralis. An area of the retina around the fovea centralis is called the macula lutea. Things that are just to the side of what you're actually looking at come to focus on the macula lutea. And the reason I bring this up is that there's a set of diseases called macular degeneration that you'll probably come across in this chapter. The lens, to come back to the lens, is suspended in place by these ligaments and some ciliary muscles. Together, the muscles and the ligaments are known as the ciliary bodies. And again, we're going to have some terminology related to that. The job of this structure is to change the shape of the lens in order to focus light properly onto the fovea centralis. The front of the eye, meaning between the cornea and the lens, is filled with a fluid called the aqueous humor. It used to be that all body fluids were referred to as humors, so this isn't funny, it's a fluid. And the back of the eye, from the lens back to the filling the entire back of the eye, is filled with what's called the vitreous humor, which is a thick jelly-like substance that helps hold the shape of the eye. And again, we're going to come up with some terminology related to that. So the retina pretty much spans the entire back of the eye. And then in between the retina and the sclera, you have what's known as the choroid layer, which is filled with blood vessels that help feed the photoreceptors of the retina. And then the optic nerve leaves through the back of the eyeball and heads back towards the brain, where those electrical impulses are interpreted as vision. In the upper right here, I just included this little image to show you the conjunctiva. So the conjunctiva is a thin membrane that lines the inside of the eyelids and then folds back around and goes across the cornea to the other eyelid and folds back around and lines the other eyelid. And the reason that I bring this up is conjunctivitis is one of the most common complaints that patients have. It's an inflammation of that membrane, and it causes the eye to take on sort of a pinkish hue, so it's pink eye. Word parts related to the eye: oculo-ophthalmo, ophthalmo, and opto all refer to the eye. So an oculopathy would be a disease of the eye. Obviously, ophthalmologists are specialists that study the eye. An ophthalmologist went to medical school, learned about all parts of the body, learned about all the medicine, got the MD, and then did an internship and residency on just the eyes. And they're allowed to do surgery and prescribe all sorts of medications. An optometrist, on the other hand, went to a regular undergraduate 4-year program, but then spent a number of years studying just the eye in postgraduate education. They don't have an MD. They can only prescribe certain things like lenses, and they can't perform surgery. So if they notice something wrong with your eye, if they can diagnose something wrong with the eye that they can't handle, they need to refer it to an ophthalmologist. Lacrimo and dacryo refer to tears, and that's this image I included up in the upper right hand here. So the lacrimal gland, or the tear gland, sits on the lateral superior portion of the eyeball and produces tears pretty much constitutively that flow down and across the eye, across the front of the eye to keep the eye moist, and then are drained by these two small canals, referred to as canaliculi, into the lacrimal sac, which is connected to the nasal cavity through the nasolacrimal duct, so that when you cry a lot of the tears end up in the nasal cavity, causing that stuffy nose. So lacrimation is simply the formation of tears. Dacryorrhea would be the flow of tears, usually an unusual flow of tears, not just your normal production of tears. Opia and opsia both refer to vision. So hyperopia would literally translate as a condition of too much vision. However, functionally what it means is farsightedness. Akinetopsia refers to motion blindness. So some people are unable to see motion. They can only see things when they're standing still, which makes things like crossing a street incredibly hazardous because they can't see cars that are in motion. If you were in a room, akinetopsia, you might see a person across the room, and if they were to walk towards you, all of a sudden for you, they would just be right in front of you. They'd go from far away to just boom, right in front of you because you couldn't see them move towards you. It's a fairly rare disorder, but a kind of interesting one. Blepharo refers to the eyelid itself, either eyelid, upper or lower. So blepharodema would be a swelling of the eyelid. Blepharoplasty refers to the surgical repair of the eyelid. Both corneo and keratosis refer to the cornea. In this context, keratosis, we saw in skin means horny. Keratosis here refers to that protein keratin, refers to the cornea. So you could have a corneal transplant if something were to damage the cornea or an inflammation of the cornea. Conjunctiva, as I mentioned before, is that membrane that lines the inside of the eyelid and the outer portion of the sclera. So conjunctivitis, inflammation of the conjunctiva, is pink eye. Sclero, in this context, refers to that the whites of the eye and the cornea, that outermost tough protective membrane of the eye. In this context, it does not mean hard. Vitreo refers to the fluid that fills the back of the eye between the lens and the retina. That's sometimes referred to as vitreous liquid or vitreous humor. It's really more jelly-like. At times you might have to remove some if the pressure inside the eyeball is too great. They can remove some of that fluid to relieve the pressure in a vitrectomy. Cyclo refers to those ciliary bodies, the muscles and those tendons that hold the lens in place and that change the shape of the lens to focus light. So cyclo refers to the ciliary bodies. Retino, of course, refers to the retina. Retinitis would be an inflammation of the retina, and a retinoscope would be a device used to look at the retina, usually externally. Iro and irido both mean the iris, the colored portion of the eye. So an iritis would be an inflammation of the iris, and iridalgia would be pain in the iris. Phaco and phaco can be spelled either with a C or a K. Both mean lens. So phacoscope is a device used to look at the lens. Phakitis would be an inflammation of the lens. Moving on to the ear. So like the eyes, the major function of the ear is to take sound information, the physical vibrations of sound, and translate that into electrical signals that the brain can understand as sound. We'll take a look at the anatomy of how that works in a minute. The other major function of the ear is to sense the position and movement of the head. So the acceleration of the head through space and the static or the still position of the head. Are you looking straight up at a cloud, or are you facing the ground? Have you turned your head to the left or the right? What is the static position of the head? Or if your head is in motion, which direction is it moving and how fast? Broadly, that means ears hear sounds and they are responsible for your sense of balance. Here's a nice picture of the ear. Working our way from the outside in, the outer flap on the side of your head is known as the pinna, and it funnels sound waves, physical motion of air molecules into the auditory canal to the eardrum or tympanic membrane. Everything from the tympanic membrane out is the outer ear. Everything from the tympanic membrane to the oval window is the middle ear. So this section in here is the middle ear. And inside there are three bones referred to as the ossicles, and they have both Latin and English names. The hammer is the first one, and it's connected to the tympanic membrane. And it touches the anvil, which is connected to the stirrup, which rests on another membrane called the oval window. So when the tympanic membrane vibrates, it vibrates the hammer, which vibrates the anvil, which vibrates the stirrup, which vibrates that inner window, that oval window. The Latin names are Malleus, Incus, and Stapes. Malleus, Incus, and Stapes. The middle ear is connected to the outside world through the eustachian tube, which is also known as the salpinx, which I'll talk to about when we get to the terminology. It's connected to the nasopharynx, the area right behind the nasal cavity. The pressure in the middle ear and the outer ear are equalized so that this tympanic membrane can vibrate freely. At times, there can be a pressure differential between the middle ear and the outer ear, which prevents the tympanic membrane from vibrating properly. You may have noticed this when you go up or down a hill in a car. All of a sudden your ears will pop and sound becomes alive again, or maybe after a cold. What's happening there is you're equalizing the pressure on both sides of that membrane so it can vibrate freely and sound. You can hear the sound better again. If it's a cold that's causing it, it's usually because of mucus blocking off the eustachian tube. And over time, the pressure between the middle ear and the outer ear become unequal. When you recover from the cold or you yawn, that opens up the eustachian tube and the pressure is all of a sudden equalized and you have that kind of pop sensation and you can hear again. Sound waves then are transmitted from the oval window here into a fluid that fills this snail-like structure known as the cochlea. And that has special sensor cells that translate the physical motion of vibration into the electrical impulses that are carried through the auditory nerve back here to the brain. The other portion of the inner ear is the vestibule, this area here, and these funny-looking loops. These are the semicircular canals, and the vestibule and these loops are responsible for your sense of balance, what position your head is in, and how fast your head is moving and in what direction your head is moving. Often referred to as a whole as the vestibular apparatus. All of this inner ear and the middle ear are kind of encased in the temporal bone of the skull that you see around here. Part of that, if you put your finger right behind your earlobe, you can feel a part of that bone called the mastoid process, which will come up in our terminology. So cerumino means wax, and that is earwax. So ceruminolysis is the breakup of that earwax. As I mentioned before, the salpinx is the eustachian tube, so salpingo refers to the eustachian tube. Rhinosalpingitis is an inflammation of the nose, rhino, and the eustachian tube. This root, salpingo, is context specific because in the female reproductive chapter, salpingo is going to refer to the fallopian tubes. The eardrum is known as the tympanic membrane, or tympano and maringo both refer to the tympanic membrane. A tympanostomy would be an opening to make a stomy, would be to make an opening into the tympanic membrane. Maringotomy would just be an incision into the tympanic membrane. As I mentioned before, the mastoid is part of the temporal bone, and if it's inflamed, you have a mastoiditis. Labyrintho refers to the balance portion of the inner ear, and so if you have an inflammation of that, you have labyrinthitis, which can lead to errant signals being sent to the brain causing dizziness. Even when your head's not moving, your brain interprets those errant signals as if your head was moving, causing the dizziness. Vestibulo refers to that portion outside the semicircular canals and outside the cochlea. And again, it's also responsible for parts of your balance. So if you have an inflammation of vestibulitis, it can cause mistaken information being sent to the brain, causing dizziness. Cochlea refers to that snail-like portion where the hearing happens. So cochleitis would be an inflammation of that particular part of the inner ear.